Do you know that breast cancer has a dirty little secret? It's true. Most people are well aware of a few main concepts when it comes to breast cancer. Even before someone's diagnosed, usually we understand that you need to get chemo, radiation sometimes involved. There's likely going to be some sort of surgery. You might lose your hair, look like you're quite sick for a while, and then hopefully recover. Most people understand that. But there is a dirty little secret when it comes to breast cancer that almost nobody understands until they're actually in treatment.
My name's Amanda. I was diagnosed with stage 4 metastatic breast cancer when I was 29 years old. I've been living with it for the past 3 years, and here's how I've been doing since.
So I want you to tell me what you see when you look at this breast. If you notice, there are plenty of dimples on it that is beginning to look like an orange skin. Doctors call this peau d'orange.
Breast cancer. 2 words that evoke fear and uncertainty in our lives. But how much do we really know about this disease? Do we know that 1 in 8 women will develop breast cancer in their lifetime? The odds are too high for us to ignore this disease. And it will also be surprising to know that in the time it takes for us to watch this video, 5 women will be diagnosed with breast cancer. Being that October is Breast Cancer Awareness Month, I wanted us to dive a little bit on this topic, educate ourselves, because they say knowledge is power. In today's video, we'll be talking about and sharing the experiences of women who have been diagnosed with breast cancer and how they lived through it and everything else that comes with it. Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. If they are left unchecked, the tumors can spread throughout the body and become fatal. Breast cancer cells begin inside the milk ducts, and this is also known as the milk-producing lobes of the breast. The earliest form of breast cancer is not life-threatening and can be detected in early stages. Cancer cells can spread into the nearby breast tissues, and this is known as invasion, and it creates tumors that causes lump or thickening. In 2022, there were 2.3 women diagnosed with breast cancer and 670,000 deaths globally. Breast cancer occurs in every country of the world, in women at any age after puberty, but with increasing rates in later life. Global estimates has revealed that in countries with a very high human development index, 1 in 12 women will be diagnosed with breast cancer in their lifetime, and 1 in 71 women will die of it. In contrast, however, countries that have low human development index, 1 out of 27 women will be diagnosed with breast cancer, and 1 out of 48 women will unalive from it. Just in case you don't know, the female gender is the strongest breast cancer risk factor. I say this because men also develop breast cancer, but it is just a very tiny, weeny percentage of them. Approximately 99% of breast cancer occurs in women, and 0.5 to 1% of breast cancer occurs in men. That means they're not even that much. The treatment of breast cancer, however, is the same for men and women. It follows the same routine of management and every other thing. Certain factors increase the risk of breast cancer, and they include increasing age. So older women are at more risk of, getting breast cancer, obesity, harmful use of alcohol, family history of breast cancer, history of radiation exposure, reproductive history such as the age that menstrual periods begin, tobacco, use of post-menopausal hormone therapy. When it comes to family history of breast cancer, this increases the risk of it. So if your mom, your aunt, or maybe your grandmother has been diagnosed with breast cancer, chances are that you might get it, but that is not absolute. That's what I said, notwithstanding, most women that are diagnosed with breast cancer do not have a known family history of the disease. Lack of a known family history also does not necessarily mean that a woman is at reduced risk. Most people will not experience any symptom when the cancer is still early, hence the importance of early detection. Breast cancer have combination of symptoms, especially when it is more advanced. and they include a breast lump or thickening. It is often without pain. Sometimes they may be hard, fixed, or movable. However, the breast itself can be lumpy at times, especially the periods when we're getting closer to our monthly periods. That is why the best time to check for this breast lumps is few days after our period. Not all lumps are harmful though, but it is important to have them checked regardless of whether they are harmful or not. Remember that the lumps can also come in the collarbone or the clavicle. There could be changes in size, shape, or appearance of the breast. Our breast size are usually asymmetrical. That is, one part of our breast is usually bigger than the other. However, sudden changes in breast size or shape, especially when it is drastic, you should not ignore it. Another signs and symptoms of breast cancer is dimpling. This is when the skin of the breast has multiple dips. That's why it is called peau d'orange, because it looks like the skin of an orange. Another one is tethering. This refers to the pulling in on the skin of the breast, which is usually noticeable when you raise your arm. There could be change in nipple appearance or the skin surrounding the nipple, which is called the areola, such as the inverting of the nipples, especially when you are not born with it. I just wanted to put this out here that inverting of the nipple is normal for some people, but when you are not born with it and then your nipple starts inverting, then that's when you should check yourself. Abnormal or bodily fluid from the nipple. This discharge can come in variety of colors. It could be yellow, it could be green, milky, clay, white, or even blood stained. And it can affect one or both of the nipples. It is important for you not to ignore these signs, especially if you're not pregnant or breastfeeding. Itchy and flaky rash. This may be a sign of an underlying issues, and it could be warm, red, sore, or evenly spreading out. People with abnormal breast lump should seek medical care even if the lump does not hurt. Most breast lumps are not cancerous. The ones that are cancerous are most likely going to be successfully treated if they are small and they have not spread to the nearby lymph nodes. I personally have removed a non-cancerous breast lump many years ago. I was even still in my teens when I noticed it, and it was successfully removed. Breast cancers may spread to other areas of the body and trigger other symptoms. Often, the most common first detectable site of the spread is the lymph node under the arms, eventually destroying the node tissues. Although it is possible to have cancer-bearing lymph nodes that cannot be felt. Over time, cancerous cells may spread to the other organs, including the lungs, the liver, the brains, and the bones. Once they reach these sites, new cancer-related symptoms such as bone pain or headaches may appear. Studies have shown that risk for breast cancer is due to a combination of factors. The main factors that influence this risk include being a woman and getting older. Most breast cancers are found in women who are 50 years or older. Some women will get breast cancer even without any other risk factor that they know of. It is important to talk with your doctor about ways you can lower your risk and about screening for breast cancer. There are risk factors to breast cancer that you cannot change, and they include getting older. The risk for breast cancer increases with age. I've said this like 3 times. Most breast cancers are diagnosed after age 50, but there are lots of women now that are being diagnosed with breast cancer from the ages of 28 to 30. I don't know the reason for this, but if you do, you can leave it in the comment section down below. Genetic mutations. So when there are inherited changes known as mutations to certain genes, such as the BRCA1 and the BRCA2, it increases risk of breast cancer and ovarian cancer. The reproductive history. Starting menstrual periods before the age of 12 and starting menopause after age 55 expose women to hormones longer, raising their risk of getting breast cancer. Having dense breast. Dense breast can sometimes make it hard to see tumors on a mammogram. Women with dense breast are also more likely to get breast cancer. So, breast density reflects to the amount of fibrous and glandular tissues in a woman's breast compared to the amount of fatty tissues in the breast, as seen on a mammogram. So just in case you don't know, there are 3 types of tissues in a woman's breast, namely the fibrous tissues, the glandular tissues, and the fatty tissues. So if you have more fibrous and glandular tissues, according to a mammogram, you are more likely to have breast cancer because the fibrous and these glandular tissues will make it hard to detect a cancer-causing cell during a mammogram until they now blow out of proportion. Personal history of breast cancer or certain non-cancerous breast disease. Women who have had cancer are more likely to get cancer a second time. Some non-cancerous breast disease, such as atypical ductal hyperplasia or lobular carcinoma, are associated with higher risk of getting breast cancer. So if you have a family of breast cancer or ovarian cancer, it would increase your risk of getting this cancer. Another risk factor is exposure to the drug diethylstilbestrol. Diethylstilbestrol was given to some pregnant women in the United States between 1940 to 1971 to prevent miscarriage. Women who took this drug have a higher risk of getting breast cancer. And interestingly, women whose mother took this drug while pregnant with them also may have a higher risk of getting breast cancer. Positively, there are risk factors that you can change, and they include being physically active. Women who are not physically active have a higher risk of getting breast cancer. That is why I will always advocate for being physically fit as a physical therapist, and especially as we get older. It doesn't have to be a rigorous physical activity. Dancing around your house to a good music, walking up and down the staircase, strolling across the streets can be a simple way of exercising and releasing endorphins. Being overweight or having obesity after menopause. Older women who are overweight or have obese have a higher risk of getting breast cancer than those at a healthy weight. So when you take hormones, some form of hormone replacement therapy, and they include those that have progesterone and estrogen, and I believe most pills or most type of contraceptions taken during and after menopause can increase the risk of breast cancer, especially when you take it more than 5 years. Then another one is reproductive history. Having the first pregnancy after the age of 30 years, not breastfeeding, and never having a full-term pregnancy can raise or increase breast cancer. Drinking alcohol. Studies have shown that a woman's risk for breast cancer increases drastically with the more alcohol she drinks. And at this point, I think taking alcohol is a risk factor to so many illnesses, so I'd say no to it. Research has also suggested that other factors, which include smoking, being exposed to chemicals that can cause cancer, and changes in other hormones due to night shift working, may also increase breast cancer. Once you know the type of breast cancer you have been diagnosed with, you can work with your doctor on a treatment plan that works best for you. There are so many different types of breast cancer, each of which is decided by the location in the breast where it begins to grow, how much the cancer has grown, spread, or metastasized, and certain features that influence how the cancer behaves. Knowing the type of breast cancer you've been diagnosed with will help you and your doctor choose the best treatment options. So briefly, we're going to get into the different types of cancer there is. So typically, we have 2 types, invasive versus non-invasive breast cancer. So generally, breast cancer usually begins either in the cells of the lobules, which are the milk-producing glands, or in the ducts, which are the passage that drains milk from those lobules to the nipples. Your pathology report will contain information about the breast cancer, including whether it has spread outside the milk ducts or the lobules of the breast where it started. So, invasive breast cancer means it has spread into the surrounding breast tissues. The 2 most common types of invasive breast cancer are defined by where in the breast they begin to grow. Therefore, we have the invasive ductal carcinoma. This is a type of invasive breast cancer that starts in the milk duct, the tube that carries milk from the lobules to the nipples. It is the most common type of breast cancer. About 80% of all the cancers are invasive ductal carcinoma. Then we have the invasive lobular carcinoma. It is a type of invasive breast cancer that starts in the lobules, the glands in the breast that produce milk. And it is the second most common type of breast cancer. About 10% of all invasive breast cancer are invasive lobular carcinoma. Some type of invasive breast cancer have features that affect how they develop and how they are treated. So triple negative breast cancer is an aggressive type of invasive breast cancer that the tests are usually negative for estrogen receptors and progesterone, while triple positive breast cancers are type of breast cancers that are positive for estrogen and progesterone receptors. There is also another type of breast cancer known as the inflammatory breast cancer. It is usually very rare and an aggressive type of invasive breast cancer. However, just about 1% of the breast cancers in the United States are inflammatory breast cancer. Micrometastases are a tiny group of breast cancer cells that have traveled from the breast to some other areas of the body, particularly to the lymph nodes under the arm. So typically, doctors will look for micrometastases in the lymph nodes in the breast area because research shows that these micrometastases mean that the breast cancer has a higher risk of spreading and may need different treatment techniques than breast cancers without micrometastases. Metastatic breast cancer, also called stage 4 breast cancer, is an invasive breast cancer that has spread or metastasized to parts of the body away from the breast, such as the bones, the liver, the lungs, or the brains. Breast cancer can come back in another part of the body months or years after the original treatment, and this is called metastatic recurrence. I have a video where a woman talked about that, and we're going to get into that later. Anyways, enough of all the theory. Let us listen to some of the experiences women who have been diagnosed with breast cancer. Let's just listen to what they typically have to say.
I got some really bad news 3 weeks ago, and that is that I've got breast cancer. And I want to share this with you because mine wasn't just a lump under the breast. It's actually quite a comical story, and I will tell you guys now. It just shows how important screening is. So I went in for an operation about 8 weeks ago. I had an ablation done, and it's a really easy procedure. It was a day op, and before going in for that, I had to see my gynae, and he just reminded me that my mammogram's coming up, and I did make an appointment for that. So I went in for my op, had everything done. 2 days later, I noticed there was like a ring on my breast. And I thought they might have burned me with the monitoring pads that they put on. And that didn't go away. It was about a week. After that, nothing made sense, and it literally looked like a ringworm. So I actually thought I picked up a ringworm, who knows how, in the very beautiful hospital. But I mean, the only explanation was a ringworm because it looked exactly like that. And you can go and Google and see what a ringworm looks like if you don't know. It wasn't painful. There was no lump underneath. If it wasn't for the mark, I wouldn't have known or felt anything. So my mammogram was coming up, and I actually cancelled it because I was thinking, I've got a ringworm. Didn't want to spread it because it's quite contagious. So I actually cancelled that and postponed it. And in the meantime, I went to the chemist. I got some antifungal cream, and I've been putting that on. As my mammogram appointment was coming up, it wasn't going away. And I thought, what? Should I cancel again? What should I do? Anyway, I decided to go. Lady asked me, what is that on my breast? And I told her this whole story. And that's not the doctor. So the doctor then looks at the mammogram, and then she does a sonar to check if there's anything. And I mean, that's your regular screening. And as I was lying there waiting for the doctor came in and she said, listen, I hear you've got a ringworm or a mark. I want to see because I'm picking something up. And I want to see if that's it. And as she did the sonar, you could see there was something there on the ridges of this red round ring. she saw some calcification. So, we will have to do a biopsy and check it out. They said they will phone me 2 days later and tell me the results. I wasn't worried. My husband didn't even know. I told him I'm going for a biopsy while I was waiting. And then the next day she phoned me and said that it's actually cancer. So yes, when I heard that it was, obviously I started crying immediately, and it was very emotional because, you never think that it will be you. You always hear about someone else. And that's why I want to share and I want to take you on this journey. And just because we found it so early, it is actually just stage 1. So I'm not going to need chemo. I'm going in the 22nd of May for a lumpectomy, and that's to take out the lump. And I'm also going to get radiation inoperatively. So that means they can do it while they open up, and we're just going to take the lump out. I don't have to have a mastectomy. I also have the type that they call a lazy cancer. So it's luminal A. It's hormone based. All in all, it's good news. And just because we found it early, and this is so important, ladies, you have to go for your screening. This changes everything. The doctor that I'm with said, if you got this late on, even though it's a lazy cancer, if it's stage 3 and 4, you have to have chemo. Finding it early could be the difference in survival or not, or kind of treatment you need to have. So I'm not going to have all these hectic treatments. Anyway, I wanted to share this, and I'm in a very good space. My faith is solid. I know I'm going to be okay, so I'm not worried. For me, nothing has changed. I feel the same. It's so weird. I was talking to someone and I said, the thing is, nothing's changed for me before knowing that I have it. There's nothing physically, but it's that knowledge of now, okay, there's something in here that we need to get out and we need to get rid of, that I don't want there. But other than that, I'm working. I haven't been crying. And it is just because I know, the way forward is not so hectic. I mean, when I prayed, I said, please, Lord, I don't want to go chemo. I don't want to have a mastectomy. And there's so many women that go through that. Can't even imagine that, because that's the one thing I was like, please, Lord. But if you have to, you have to. Different is really, type of cancer that you have, but also early detection. Let's bring awareness. Let's bring hope. And thanks for listening.
He mentioned something about having a procedure called cardiac ablation, and I just wanted to clear that up a little bit. So cardiac ablation is a treatment that is used to stop or prevent irregular heartbeats, medically known as arrhythmias. An arrhythmia happens when the electrical signals that tell the heart to beat don't work as they should. The heart may beat too fast or too slow, or the pattern of the heartbeat may be irregular. Depending on the type of irregular heartbeat, cardiac ablation may be one of the first treatments. Other times, it is done when medicines or other treatments do not work.
So here's my story on how I got diagnosed with breast cancer just after turning 29. Okay, so when I was 28 and a half, in the springtime of 2019, I felt firmness on my left breast, just on the side of the nipple, towards the outer edge, towards my armpit, right? And at that time, I was very active at the gym. I was doing a lot of, heavy lifting, including bench press. And so when I went to my first walk-in clinic to have it assessed, I think me saying that it was a fear of muscle imbalance or something along those lines, the doctor just agreed and went along with that. And she's like, it's nothing, you're young, it's probably muscle imbalance. So I was relieved. I was like, I'm glad she agrees with me, but I'm really upset at myself for letting it get so imbalanced, right? I work on my body almost every day, and I've got this crazy lopsided chest. Let's work on that. And the months go by. I get through the summer. I have, in the back of my mind, a feeling I should get it double checked, but I just want to enjoy summer. My partner was about to move back across the country to start a new job, and I would later join him to buy our first place. And so we were just, camping and prepping for this big move in life transition. I moved back in with my parents. He moved back home with his parents, and we would reconnect in the spring regardless. However, on my 29th birthday, September 25th, I took an hour off of work and I went to another walk-in clinic where a male doctor looked at me very quickly. He asked if I had a history of breast cancer. I said no, but he seemed very concerned, and he basically wrote me a prescription, I guess you would say, or a direction to go to the Abbotsford Hospital here in British Columbia and get a mammogram, or a screening first, rather, I should say. So fast forward a few days, I'm at the hospital. I get my screening done. Immediately, they ask if I can have a mammogram done right then, right there. I said yes. Obviously, my mind starts racing. Right after that mammogram, they book me a biopsy. So I had a feeling I already knew at that point what was going on. And unfortunately, by that point, my breast had started leaking fluid, and it was extremely hard and almost painful to the touch.
Okay, let's do our self-breast exam together. It's important to do this once a month, a week after our periods, and preferably in the shower, once tenderness and swelling have decreased. Also, that way, you're doing it at the same time every month. As we know, breast cancer is the most common cancer in women, and Black women are more likely to die from it, which in part has to do with access, but that's another conversation for another day. The American College of Obstetrics and Gynecology found that over 50% of women over the age of 50 who are diagnosed with cancer found it themselves. There's been a drastic rise in younger women being diagnosed with cancer. This is why it's important for us to pay very close attention to our breasts. Know what is normal for you, so at the slightest change, you hopefully get immediate intervention. Earlier detection is key. It can and does save lives. So what are we really looking for, or what are we hoping to not find? First things first, your breasts will be completely different from someone else, so it's important for you to be aware of what your normal breasts look like. So we're paying attention for any lumps, any changes in how your nipple looks, such as like a newly inverted nipple, dimping or denting of the skin, changes in the size or shape, changes in the color, such as redness, like an orangey color, any abnormal discharge from the nipple. Looking for changes like clear discharge, bloody, black. Also, don't forget to check the armpit or the collarbone. And if any changes are noted, next step would be a mammogram. I'll see you next time.
So in the next video that we'll play, the woman basically talked about the signs and symptoms she experienced before being diagnosed with breast cancer. I think it is important for us to listen carefully because it might save one or two people. And also remember that signs and symptoms might differ per individual.
This is a great question, but also a really long story, so I'll try to be quick. It all started right after Thanksgiving. The Saturday after Thanksgiving, I hosted a Friendsgiving slumber party with my girls. So that was that Saturday. By Sunday night, I started just to feel like a little bit of like pains in my hip, my left hip. Initially I just chucked that up to like, I just hosted a party, I went through all this stress, so my body was just hurting. By the next day, Monday morning, I woke up to go to work and I had this like pulsing pain in my left hip. So, I went to work regardless, but halfway through work, I just told like the HR at work, like, I don't feel good. My leg really hurts. I'm going to go to an urgent care. So I limped into my car and went to the urgent care and, just explained to them that my hip was really hurting. Like, it's in the joint. It's not in the muscle. You can't like massage it away or anything. It was just hurting. Regardless if I'm standing or sitting or laying down, it just really hurts. So they did an x-ray of my hip, and didn't see anything that could be causing the pain. and just told me to go home and keep taking ibuprofen, and said if it lasted more than 2 to 3 days, I should go see an orthopedic doctor. So I went home, took ibuprofen, and this is Monday night. By Tuesday morning, I woke up and I just didn't bother going to work. By Tuesday night, and I still just kept taking the ibuprofen. By Tuesday night, I didn't have any pain. Like, it was just all gone. So yeah, I was fine. Or so I thought. Wednesday morning, I woke up and I went to work. It was all good. Came back from work, still all good. Maybe a little tired, but just all good. Thursday morning, I woke up and like all the pain was back. So the pain in my left hip was back. Then I had pain like right in my chest, in the center of my chest, like in my sternum. I had pain like in my 2 shoulders, and then I had pain like pulsing down the sides of my ribs on both sides. So definitely didn't go to work. That was a no-brainer. I still stayed home and just took the ibuprofen. And by Tuesday night, all of the pain was gone. Like, it was just all gone. So Friday morning, I woke up, went to work. Everything was fine. Saturday was fine. Sunday was fine. Monday, Tuesday, Wednesday, no pain at all. On Thursday, I went to work. It was about like 2 p.m. The pain in my chest started coming back. And then I had this new pain in kind of like my tailbone area. And then from there, I just went to the emergency room from work. So I was in the ER. They ran a whole bunch of blood tests. They didn't see anything wrong. I did an x-ray from my clavicle, from my my upper chest all the way down to my pelvis. And there was nothing wrong. I did an entire CAT scan, and there was nothing wrong. And then at the last minute, they were like, oh, let's do a Lyme disease test, because it could be that. So I don't want to make the video too long. So yeah, they just did all that and sent me home just to keep taking more painkillers.
Story time, because it will help answer this question. I was initially diagnosed with primary breast cancer in 2018, and I was 36 years old. I had chemotherapy, I had a lumpectomy, and I had radiotherapy. And after I completed all of those treatments, I was told that there was no evidence of disease in my body. So I went back to work, went back to trying to rebuild my life. But when COVID happened, at that point, I started to experience a lot of pain in my body. I went to the doctor quite a few times with my pain, and to be honest, I was ignored at each stage. Eventually, an MRI scan came up, my last one, because I was about to turn 40, and that scan showed that the cancer had come back and it had spread outside of my breast, now making it stage 4 and incurable. And since being diagnosed with stage 4 cancer, I have been on gemcitabine and carboplatin. That worked for a few months, but then when it came to an end, because that drug, you can only take it for a certain amount of time, unfortunately, it came back. By coming back, what I mean is that it continued to grow and it continued to spread. I ended up having further lymph nodes that were affected, and the sternum and chest wall became active again. So after that, I really pushed to be able to enter a clinical trial, but there was no guarantee that I was gonna get on it. But luckily, I did get on it. I am on a clinical trial that's called Pavement at the Royal Marsden. And so far, is just slowing down the growth. And I guess that's the best thing that we can hope for with any line of treatment. I have been on this clinical trial since last year, and it's not been easy, but it is slowing it down, which makes me incredibly happy because it's buying me time, but also it's allowing me a quality of life that I wanted. And hopefully I don't have to move to my next and probably last effective line of treatment anytime soon.
Hi, my name is Alicia. I am from Sydney, Australia, and I am 32 years of age. I am wanting to share my story with you all just to raise awareness that unfortunately breast cancer does affect even young people. I was diagnosed when I was 29 years of age. Then after a few more tests, they had discovered that it had actually gone to my liver. So for the last 2.5 years, I've been living with stage 4 metastatic breast cancer. I originally found my lump when I was just 27, and for 18 months I was dismissed by 6 different doctors. I'd visited maybe 20 to 30 times, 2 breast specialists, all because I was too young. I'm a natural bodybuilder, so I was too fit, and I had no family history. So I want to share my story to help raise awareness with other young people who may be affected by this and change views that it doesn't just happen to elderly people.
On December the 19th, 2022, I was declared cancer-free after doing chemotherapy, double mastectomy, and then had immediate deep flap reconstruction surgery on my breast. I was declared cancer-free. On April the 19th, 2023, just 4 months later, I got a call saying that the cancer has returned. I am really struggling in my thoughts right now, and I'm very emotional, but I'm very confused as well. I am doing this video because I want people to know how I found it the second time and explain that, because I feel like it's important. So I was going for my normal checkup with my breast surgeon, and she was just, checking me out, making sure everything was going okay, making sure I'm healing okay. And she mentioned, like, how are you feeling? And I told her, I said, it's so weird because every now and then I'll get like a similar, very similar pain in my right breast in the same spot as to the pain that I had when I had the cancer there. And I said, it's so familiar that it's like triggering, because I'll immediately be like, and then I'm like, wait, no, it's gone. It's gone. They removed it because they took out all of my breast tissue. They took out all of my breast tissue. So I'm like, okay, it's gone. My mind's playing tricks on me. So I explained this to her, and she told me it could be something called phantom something, to where you feel like it's there, your mind's playing tricks on you, but it's not. And then she was like, well, let me feel it and check it out. She did. I saw concern on her face right away when she started feeling in there, and there's another mass. She proceeds to tell me that it's probably fat necrosis, where fat cells just die and they get hardened. So I still want to do an ultrasound to double check. We did the ultrasound. We did 4 mammograms, did a biopsy, and they called me yesterday and said it's cancer in the same exact spot. I'm baffled. I literally thought I was moving on with my life. I literally thought this was in the rearview mirror. I thought this was behind me. I thought I was done on this battlefield, and now I don't even know. So check yourselves, feel yourselves, and tell people the pains you're having. It's important.
This is so sad, and I'm giving this particular woman my prayers and heartfelt wishes. Remember, I've talked briefly about breast cancer recurrence, and I wanted to talk about where it can happen. It can happen locally, and this means the breast cancer will return to the same breast or nearby tissues. It can happen regionally. This means the cancer will spread to nearby lymph node or tissues, and it can happen distantly, and here the cancer will spread to distant organs like the bones, livers, or brain.
You still have cancer? I thought you were in remission. My journey with metastatic breast cancer, or stage 4, started in 2021. And I think the assumption with from most people was that there would be 4 rounds of chemo, surgery, 13 rounds. Like, people were kind of expecting a date, and then it would be, I was done, cancer free. And in this situation, that has not been the case. It's really tough sometimes to have those conversations with people to kind of explain right now. Hopefully, I'm praying that I get to NED, which is no evidence of disease. But right now, treatment is ongoing. So people are always like, well, when are you done with treatment? We're going to celebrate. Or when are you expected to be cancer free? And I think part of this is always educating. And I do pick and choose, right? Sometimes it's like not the right time to be at a happy hour and someone's like, oh, how's it going? When are you done? Definitely over the mocktails, not the right moment. But sometimes when I am in those one-on-one conversations, I try to explain to people how they treat a stage 1, stage 2 is going to be different than how they treat stage 4. And I think there are a number of people, men, women, young, old, who really don't know what metastatic breast cancer is. And I know that was even the case with me when I was diagnosed. I never really understood that breast cancer could even leave the primary source, which is the breast, but then once it did and goes to places like the liver, the brain, the lungs, that there is very much a different treatment plan. I think the other thing that really surprises people is that when they see me, they're always like, wow, you look great. You have so much energy. You're going to work. You're able to do low impact workouts. Like, you look great. And of course, I'm not going to show up to a housewarming, a party, work, and be like, wow, I feel super crappy from chemo, or bring down the mood. I do have those, again, conversations with super close friends, or if people ask and I feel like having that vulnerable moment. But it can show up, and a lot of times does for MBC, as an invisible illness. And so I think it's hard for people to tie, okay, wow, this person looks like this, they're living this normal life, but then wait, they're still in treatment, or they're still undergoing some form of treatment. And so whether that is an oral chemo, IV chemo, hormone therapy. So yeah, that's just something that I wanted to share about kind of the comment of, I thought you were in remission and oh, you look great.
Hey y'all, so a lot of people have been asking me the symptoms that I experienced leading up to my breast cancer. So let me explain. So number one, this is the most common one that everybody seems to find, and it is the lump that's on my breast. The lump, it was no more than maybe like this big. It was hard. It had no discharge. I didn't feel any pain. Like I said, it just kind of sat there like in my upper left quadrant. So like I said, that was probably the number one that kind of led me to going to the doctor. But here's some other ones. That's a discharge that I had in my breast. My breast was leaking, not as much, but like I said, it kind of went through my shirt, and that kind of like raised concerns. I noticed the shape of my breast, like, you know how they're normally perky? Well, this one was more like a U-shaped. It kind of had like a weird look about it. And that raised concerns. Even after my surgery, I noticed that it was like a weird shape. And you know how when you look at yourself, you can tell what's going on. Number three was the wrinkles that were in my breast, like little fine lines leading up to like the area. That was number three. And I was developing like sharp pains. It wasn't very often. It was be like, oh, that was like a feeling that kind of raised concern. But the one that led me up to going to my surgeon was the lump that was on my breast. Like I said, I thought it was scar tissue from after my surgery, but it wasn't. And I'm so glad that I listened to my body. I kind of like, as I got out the shower, you know how you look at yourself? Well, I looked and I was like, okay, this one is super huge versus this one. And, you know, like I said, do your 2-finger method. I kind of like, you know, ever since my surgery, I kind of do monitor this breast. So I'm glad I did. And that's how I found mine. Not in the shower. I didn't do my 2-finger method that people, you know, normally do. Like I said, I just did mine, and I was kind of like feeling around it because I was like, something feels different. And like I said, I was like, I had my surgery up here. Why am I feeling like a lump up here? So I thought it was like another benign cyst that I had my first surgery, but it wasn't. Like I said, and my doctor raised a lot of concerns when he was like, go get it looked at and follow up with some appointments, and we'll make sure that whatever it is, we, you know, get a hold on it now. So listen to your body. If you pay attention to your body, you will notice like what's wrong with it. Your health is your wealth. If you see something, say something, ask a doctor. Like I said, if it's still bothering you, ask for a second opinion, or you can always advocate and say, hey, I know we looked at it, but could we do a little bit more further studies in it to kind of make sure everything's okay? Just so I feel good, my well-being. And like I said, just listen to your body. It'll tell you lots of things, but those are probably the most common ones that I've had. So, love y'all so much. We'll talk soon. Bye.
Anyways, we have come to the end of the video. Early detection significantly improves treatment. This is why breast cancer awareness and education is crucial. We're supposed to share the word so that people who don't know can know, and they'll be able to, manually check themselves. Always remember to share the word. Regular screening, self-education can save lives. Thank you so much for watching. My name is Sandra. Do not forget to like, comment, subscribe, and share if you care. See you next time. Bye.